So our speaker tonight is Dr. Lucas Pantaleon. He is a veterinary advisor and founder of Pantaleon PLLC. He has experience in different sectors of animal health, holds a master's in veterinary sciences, an MBA, and is a board-certified large animal internal medicine specialist. He participates on a board and several advisory committees, which allows him to be involved in topics that matter to animal health, such as antibiotic use, traceability, and innovations in agriculture. In his advisory role, he works with companies and individuals around topics that blend science, business, cooperation and collaboration, such as infection prevention, One Health, and value-based care. He educates and speaks around the U.S. and internationally, and has written many articles on topics related to infection prevention and improving patient care.
Well, thanks, Claire. Thanks for the introduction. Thanks to Thrive for the invitation. It's a real honor to be here with you, speaking about a topic that I'm very passionate about, and is this combination about One Health, infection prevention, and specifically tonight, what is the role that the general practitioner and the animal healthcare team in general practice plays around these roles. But before we start, I wanted to tell you a little bit why do I think infection prevention is a cool topic. So it is a cool topic, and the reason that I think infection prevention and One Health are interesting topics to me is because if you think about these topics, they truly lead or are a human behavioral science. So they are subjects about how you can influence human behavior and hopefully change human behavior to better protect the health of patients. The other thing that I think is interesting in this arena is that there are a lot of interesting technological advances coming in different sectors of animal health that will allow us to better diagnose, better treat, more quickly do some diagnostics at the patient side, which in turn will allow us to practice better infection prevention and better treating animals with a more accurate diagnosis. And the third aspect of these fascinating topics is that it is an always changing science. Infectious diseases and infection prevention is something that is very dynamic, so it requires a constant learning and constant teaching. So when we think about infectious diseases, it is all related. There are infectious diseases that affect the human health. They affect the animal health, and some affect both. When you think about infectious diseases, you could have infectious diseases that are endemic to an area, or infectious diseases that are emergent in an area, so they are new infectious diseases coming into a new area. And infectious diseases could cause an outbreak all the way to a pandemic, depending how far these diseases are spread within an area or a region. But ultimately, infectious diseases will have an effect on morbidity and mortality in human and animals, and also will cause economic disruptions that could be of different magnitude depending what type of infectious disease you're talking about. And if you're talking about an outbreak that is localized in a region, or if you're talking about an epidemic or a pandemic that is more spread around a country or even across borders internationally. Let's concentrate in our area of interest tonight, which is the small animal or companion animal sector. If we think about, there are about 94 million cats and 90 million dogs in the United States as pets. This is a very sizable industry from the economic point of view. If you look at the statistics from 2018, pet health related services had been an industry in which people had spent about $72.5 billion in caring for their pets. Of these, about $18 billion are directly related to veterinary services. If you think about the role that we veterinarians and the animal healthcare team plays in companion animals, a lot of what we do on an everyday basis, it relates to infectious disease prevention or treatment of infectious diseases. We deal with animals that they're coming in with skin infections or ear infections or diarrheas, and also we are playing a very important role in how do we prevent these infectious diseases by practicing vaccination and deworming into these animals, and also educating the clients and the owners about how to properly prevent infectious diseases. If you think about some of these infectious diseases as well are zoonotic, so they could have an impact in public health. Another sector of the the pet care industry that has been growing over the years is the pet boarding, doggy daycare sector, which is also an important industry. And this is an industry that has been valued about $6.1 billion of people in the United States that spending in this type of category caring for their dogs. If you think about this sector from the infectious disease point of view, it is a high risk situation where you have multiple animals commingling into one area, sharing the same environment and sharing toys. Infectious diseases in this type of environment, if you don't have proper education of people running these doggy day care, or if you don't have proper vaccination of animals coming into these places, infectious diseases could spread very widely, having a severe economic impact into these institutions, as we saw, for example, when we had the H3N2 influenza outbreak in the United States, that some of these facilities were closed down due to an outbreak of upper respiratory disease secondary to influenza. Another important area on the companion animal sector is the shelter environment. And the shelter environment in the United States is composed of about 14,000 shelters with 4 million animals going through shelters per year in the United States. When we look at the shelter environment from the infectious disease and infectious disease prevention point of view, it is an environment that you have animals coming in from multiple sources, animals that normally do not have a very clear or they have an unknown health history, animals that commingle in one place, and animals that are of different ages. In turn, it's a high-risk situation from the infectious disease point of view. And in these particular places, veterinarians and the people that care for these animals must have a proper infection prevention protocol in place. When we talk about the different type of patients that we see, I believe that veterinary medicine has advanced tremendously over the years, and we are able to care better for our patients, and really these pets are living longer. And when you think about having patients that are older, these type of animals, They could acquire some type of chronic disease, for example, cancer, which would have a negative impact on their immune system. And these animals could be more prevalent to acquire an infectious disease. Or animals that are older could, if they acquire upper respiratory disease, they have greater chances for secondary complications like pneumonia. So when we care for these particular patients, we must keep that in mind and truly educate owners to practice proper infection prevention. But also at risk are animals that are healthy and they are young. As you can see in this picture, 3 puppies sharing the same stick. When you share in a stick, you can share infectious diseases as well. So proper vaccination, proper parasite control on the set of the population is also very important. Animals and humans, especially pets, are now part of our family. And the microbiome of these animals is truly shared with the environmental microbiome and the human microbiome. So we are all part of the same environment. And by sharing this microbiome, we share some good part of the microbiome, but also potentially could share some pathogens that could cross species. This close relationship between human and animal and human and pet open the door for some of these pathogens to potentially cross species. So the zoonotic part of infectious diseases is something that we need to keep in mind. And I can give you an example of these. Animals that play a very important role as therapy animals going into what it would be considered a high-risk situation, like a human hospital, helping sick humans to get through these challenging times a little bit better, do have a higher risk to potentially carry some of the pathogens in the hospital back into the community. For example, MRSA, or methicillin-resistant Staphylococcus aureus. And it has been shown that these type of dogs going into these environments, if they are allowed to be fed treats by the patients, or if they are allowed to lick the patients, they have a higher risk of getting colonized by MRSA and potentially carry that pathogen back into the community. It is important to think that if we have patients that play this important role as therapy animals, we need to educate ourselves about how to better prevent infectious diseases in this setting. When we think about infectious disease and infectious disease prevention, we tend to think in terms of our little own environment, so our little clinic or our hospital, and we tend to think that that is where everything happens. But this concept is truly global, and infectious diseases do not respect borders. Nowadays, with the availability of international travel, animals and people, and with them diseases, can cross borders very easily. I'll give you an example. This is a picture of some dogs that have been rescued in Puerto Rico a few years back when they had the misfortune of having the hurricanes, and they're getting ready to be loaded on an airplane to come into mainland USA. When you think the challenging situation that these animals had gone through, they've been separated from their owners, they've been through a very stressful situation. Once these animals been rescued, they're probably have an unknown health history, vaccination history, and they're going to come into new environment, into new country or in new region, potentially carrying infectious diseases that could not only be transferred to other dogs, but potentially other animals and humans. So as veterinarians, if we care or we are part of a shelter environment that is receiving animals from overseas, we must keep this in mind and establish proper infection prevention protocols to care for these animals before they are released into the population. As you can see by these examples, I hope I convinced you that the veterinarian, especially the general practitioner and the team, plays a very important role in infection prevention. When we talk about infection prevention, sometimes we tend to use it as a synonym with biosecurity. And maybe a lot of you guys have heard biosecurity meaning the same as infection prevention. But in reality, those two terminologies are a little bit different. When you think about biosecurity and in terms of biosecurity, we think about these close populations, for example, a swine barn. And biosecurity is what the measures that we implement in order to prevent from a disease to enter this type of close population. For example, before you go into a swine barn, people will shower in and shower out to prevent any infectious disease to get into this population. Now, if you think about what our daily life is as veterinarians, it would be very difficult in this type of open populations to have your clients to shower in, shower out before they bring your animal to the clinic. In this type of scenarios, we think about infection prevention and control. And these are the measures that we have in place and the plans that we have in place to try to identify an infectious disease at the source as early as we can, because an infectious disease is going to come into our clinic. And then we have measures and protocols in place in order to prevent that infectious disease to spread to other animals around our hospital. But in any case, if you talk about infection prevention or biosecurity, their aim is the same. And I like to use the definition of the three pillars. And infection prevention is all the strategies that we put in place in order to prevent infectious diseases in human, animal, and the environment. Therefore, if you're familiar with the One Health definition, I would argue that infectious disease prevention, it's a One Health discipline, and it should be looked at and applied with a One Health concept in mind. One Health is this umbrella of different disciplines, from individual health to population health to ecosystem health, that deal with different aspects of health. We have on the right there comparative and translational medicine, which is not going to be the topic of our talk today, but on the left we have zoonotic infections, which we are going to be talking about, and more specifically we're going to be talking about some of the interventions that we put in place in order to control infectious diseases, and we're going to be talking about antimicrobial use. I think the One Health definition is very interesting because it talks about breaking the silos between different disciplines and bringing different disciplines together to collaborate to tackle very complex issues such as infection prevention, antibiotic use, all looked at from the One Health perspective, by which we have this multidisciplinary and interdisciplinary approach of everybody working together. Veterinarians, human doctors, environmentalists, etc. Good. I hope you guys are doing well. When I have a live presentation and I see, it's easier to gather how you guys doing, but I hope you're doing well and you're still awake. So we have a little break here, and this is a picture of the Iguazu Falls in the northeast corner of Argentina, in the border between Brazil and Paraguay. So it's a beautiful place to visit if you haven't been there yet. When we talk about infectious diseases, 75% of the emergent infectious diseases that have happened over the later decade have been of zoonotic origin, as you can see in this picture. These are diseases that have caused outbreaks and pandemics in different areas around the world, having a severe impact in morbidity and mortality of the human and animal population that they affected, and having significant economic impacts on the regions in which they developed. Some of these emergent infectious diseases, they are zoonotic, and also they have emerged from wildlife populations. And this is an area that is under a lot of study right now to try to identify some of the potential zoonotic viruses that circulate in these wildlife populations. And you have the example here of the complex cycle of Ebola virus that I'm sure everybody's familiar with, that it has its origins in the wildlife population. It is a zoonotic disease, and then it spreads from human to human and has caused severe outbreaks and epidemics in Africa. When we think about emergent infectious diseases, viruses are a big worry, especially viruses that are RNA viruses, because these viruses have a high number of nucleotide mutations and errors in their genetic material. Therefore, these viruses have the capacity to adapt and cross species. Some examples of these viruses are coronaviruses, and as you can see on this picture, the influenza virus. The influenza virus is one of the viruses that keeps people awake these days because it's one of the ones that has a very high potential to cause an epidemic or a pandemic. And the reason for these is that this virus circulates and is transmitted around the globe via some of these migratory aquatic birds, that they acquire the virus via the oral route, these viruses multiply in very high numbers in their gastrointestinal tract, and it gets eliminated in very high numbers in the feces. So when these birds migrate and stop to feed in different parts across the migratory route, they contaminate areas where these viruses. And as you can see in this chart, these influenza viruses have the capacity to mutate and affect domestic birds and domestic poultry population, but also can cross into the mammalian species and, of course, into humans. So this is a virus that is very important to continue to investigate and monitor and have very strong surveillance and vaccination programs. Another microorganism that is emerging and is of zoonotic potential as well are bacteria, and more specifically, these multi-resistant antimicrobial bacteria that have emerged in the healthcare system, but also in the veterinary system, as we'll see in a minute. It's causing high cost of care and poor outcomes in the healthcare system around the world. And in veterinary medicine, we don't have a lot of data about these bacterial complications, but you can see this picture. This is a picture of a surgical site infection after a TPLL surgery on a dog. And TPLL surgery has a relatively high rate of complications, up to 28%, with up to 8% of them needed implant removal. It caused surgical site infections after TPLO. It cost the veterinary care system about $15 million a year. And it's been shown that if some of the bacteria that contaminates and produces an infection in these sites is either an MRSA or MRSP that is resistant to antibiotics, the outcome on these animals is worse and the costs are greater. As I hope I convinced you, zoonotic diseases are real, and they are transferred not only in areas that they are far away in the world, but it happens and they are part of our daily practice. So as veterinarians and the animal healthcare team must play a very important role in trying to identify and prevent some of these diseases. Okay, Kentucky can get cold. This is a picture of a cold, frosty morning, and that morning was particularly interesting because it was so cold that the frost actually froze on the tree branches. So that's where you can see it was some interesting picture that I thought I would take a picture for prosperity, and that's what you see there, the frost frozen on the tree branches. When we talk about One Health, we talk about and we think about this cross-disciplinary teamwork approach. And there are three things that are important from the infectious disease point of view. One of them is prevention. The second one is detection. And the third one is response. We need to do these thinking in One Health terms. So what are some of the things that we do as veterinarians in order to prevent, detect, and respond with some of these infectious diseases? One of the things that we do on a daily basis is vaccination. General practitioners play a key role in that. We clean and disinfect our hospital and hopefully practice proper antibiotic stewardship. But also important is to do surveillance and do isolation and quarantine and have proper infection prevention and our biosecurity protocols in place. And sometimes there are regulations that need to be put in practice in order to prevent, for example, infectious diseases to cross borders. Let's talk a little bit about surveillance. Surveillance is something that is very important because it allows us to manage and assess what's happening with infectious diseases in our hospital or in the community that we serve. It allows us to adapt. As we learned, infectious diseases are very dynamic and they could change. Some are seasonal. Some they emerge, they weren't there before. For example, the H3N2. So by monitoring, we can assess what is going on with the infectious disease rate in the community or in our hospital and be able to adapt our infection prevention protocols. And also, importantly, by having proper surveillance, allow us to be aware of the situation and give feedback to the team about what or how our infection prevention protocol is doing. I want to show you a little animated graph here that I like to call the surveillance loop. And you think on the left square, you have a clinic or a shelter. And then on the right side, there's a surveillance center, which you can think of as a referral laboratory at a university. Let's say that you have an infectious disease event or an outbreak or a case of an infectious disease that is out of the ordinary. So you would report that or send samples to the surveillance center, which you will analyze, interpret that sample, generate some data, and generate some information, which will send it back to your clinic with some recommendations for you to take action. This is interesting to me because it talks a little bit about the collaboration and kind of reaching out of the walls of your clinic or your hospital or your shelter and try to gain some feedback and recommendations on how to deal with an outbreak or a weird infectious disease from experts outside of your institution. One of the easiest things that veterinarians and the animal healthcare team does on a daily basis as a great surveillance tool is monitor those animals with vital signs. So if you have a spike on temperatures, or if you have an abnormally high rate of respiratory diseases in your shelter, by looking at these animals on a daily basis, you're going to be able to detect that easily and hopefully soon enough to put measures in place. This is, I think, a very interesting graph that talks about the importance of zoonotic disease control. And you see different curves here, which talks about first what happens with the zoonotic disease. Animals get exposed, then animals develop clinical signs. Secondarily, humans will get exposed, and humans will develop clinical signs and will seek medical care. What is important here is to see the dark black line that talks about the cost of controlling that outbreak. They get exponentially more expensive as humans become sick with the disease. That talks about the importance of having surveillance, strong surveillance systems at the source, and also establishing control measures at the source, especially important before, at the animal point, before animals get sick and before they can transmit it to humans. Because if we wait, it gets more expensive. And we'll see these here in a minute, and we'll examine the case of rabies. That will be a good example of a zoonotic disease that follows this pattern. We've talked about this interaction and close relationship between humans and animals, and pets and humans being part of the family. Therefore, vaccination is important, not only in pets, but as well in humans. Because that will allow animals to share our homes safely. If we vaccinate dogs, for example, that will create, or generate rather, an increase in immunity in the dog population. So we'll generate herd immunity, which will decrease the chances for that canine population to become ill with a particular disease. As we saw, some of these diseases, and due to the close contact between human and animals, some of these diseases are zoonotic. Therefore, if we protect the canine population and achieve herd immunity in the canine population, we are secondarily as well protecting the human population from some of these zoonotic diseases. Rabies, as you very well know, is a zoonotic disease, and 99% of the rabies cases are due to bites, from domestic dogs. In the United States, rabies programs have basically eliminated human rabies because there are strong vaccination plans in the domestic dog population. The United States spends about $500 million in rabies prophylaxis, which is vaccinating dogs, pre and post-exposure prophylaxis, and diagnostics. However, rabies remains endemic in some areas of the world, especially third world countries. And those poor countries, they have a significant number of human cases secondary to domestic dog bites. Canine infection respiratory disease is a complex of different diseases for which some of them we are able to vaccinate, for example, Bordetella and influenza. In the case of influenza, as we learned, it is a zoonotic disease, potentially zoonotic disease. However, we have not seen the canine influenza virus jumping into the human population yet, I would caution. But I would argue that because these very close contact between human and dogs, by having a good vaccination, good herd, a strong herd immunity in the canine population, we could potentially be preventing from these virus to potentially jump into the human population. So it is important to achieve high herd immunity, and we veterinarians play a key role in vaccinating and educating these owners about the importance of vaccination. And I'll give you an example of what happened when we did not have good herd immunity, such as the case of H3N2 influenza virus, which was a strain of the virus that it was foreign to North America and came into the United States from Asia. And this strain was not in the part of the vaccinations, the vaccines that we had in the United States. Therefore, we did not have herd immunity in the canine population. And when this virus came in, it basically found a naive population and was able to spread very easily and cause outbreaks. Vaccination truly saves lives, and this happens in humans with, for example, Streptococcus pneumoniae vaccine preventing Streptococcus pneumoniae pneumonia in people. Flu vaccination in people prevents MRSA pneumonia in people. In poultry, for example, vaccination against Salmonella typhimurium decreases the chances of food poisoning with Salmonella typhimurium. So there are multiple examples, all One Health examples, by which vaccinations save lives. Today, there's this movement of people pushing against vaccines in the human world. And we've seen that some of these diseases that were considered basically extinct by good vaccination protocol and achieving a high herd immunity in the human population over the years have reemerged, like for example, measles. And this is a tendency that we've seen that some people in the companion animal sector are pushing against vaccines. So it's, I think, our responsibility as primary care veterinarians educate the owners and gain their trust and really educate them about the importance of having proper vaccination in their companion animals. Let's shift gears here a little bit and talk a little bit about antimicrobial resistance, which is the biggest public health challenge of our times. As infectious diseases, antimicrobial resistance does not know international borders. Therefore, it truly is a global issue. Today, there are approximately 700,000 people affected by an antimicrobial resistant microorganism. If this trend would continue as today into 2050, it is estimated that the number of people affected by an antimicrobial resistant bacteria is going to climb to 10 million, costing the world population $100 trillion. In veterinary medicine, a survey stated that 82% of veterinarians are concerned by the emergence of microbial-resistant microorganisms, and we all should be. And the reason for it is because antimicrobial resistant infections such as these MRSA, skin infection in a dog, increases the cost of care and decreases the outcome. Thinking about antimicrobials, there are three things that are key: prevention, containment, and stewardship. Prevention, we talked a lot about, and disease prevention is very important. Should be the first thing that we always do as veterinarians, trying to prevent disease. If you prevent disease, the disease is not there, and therefore we don't need to use antimicrobials. For example, in a shelter environment, proper isolation and quarantine will decrease the spread of that disease. Therefore, will be less need to use antibiotics. Containment is also important. For example, this dog that is affected by a skin MRSP, multi-resistant to antibiotics, we are not going to have this dog go out and play in a doggy daycare. It needs to be contained until it gets better in order for that disease not to spread into other animals. And stewardship, I think this is very important, and there are different definitions of stewardships, but I like this one because I like the fact that talks about the importance of preserving a very important tool that we have in our hands now to treat our patients, which are antibiotics. But we need to be very responsible about using this tool and have oversight on using these tools, because really it's all about safeguarding the animal, the public, and the environmental health, a One Health approach. When we think about stewardship, it's about using antibiotics judiciously and try to follow guidelines. But it's not all about judicious use. It's also about thinking about alternatives. Is there something else that we can do in order to treat that animal? Do we really need an antibiotic? So we need to really think about and question ourselves if antibiotics are truly necessary. Ideally, try to base our decisions on evidence-based. I know this is not always easy. And try to monitor the outcomes. Monitor that animal. How is it doing? Is the owner being compliant? Is this animal getting better in 3 days? Does it need really the course of antibiotics that we prescribed initially, which was 14 days? So monitoring what we do is as well important. A thing that came out of the last CDC threat report that I believe is very fundamental on antibiotic stewardship is the concept of leadership. And veterinarians must take a leadership role in this very important, challenging problem. And we must be stewards, good stewards of antimicrobials. As infectious disease prevention, antimicrobial resistance, and stewardship is a very dynamic science. There's always something new and changing. So as leaders, we should be learners, and also we should teach and communicate the importance of proper antibiotic use to the owners of our animals. Because a lot of times we are under pressure by owners coming into our practice, and all they want is for that cat that is sneezing to get a shot so it can get better. But we need to make sure and make public statements and educate the owners and our clients about when and when not antibiotics are appropriate. Following guidelines is important. In veterinary medicine, this is just getting started. There are at least 3 guidelines and a consensus statement, but we must follow and be familiarized with some of these guidelines. I was concerned by some of the stats, which the survey that showed that 88% of veterinarians are not aware that these guidelines are out there. So using antibiotics responsible is about being familiarized with these guidelines and use an evidence-based medicine approach. And try, when we can, do antimicrobial culture and antibiogram, because having an antibiogram is part of stewardship. Because antimicrobial resistance is already among us in the companion animal sector. A survey that they, or a study that they did at Lincoln Memorial showed that in Appalachia, there are shelters that they recover antimicrobial resistant bacteria from dogs and the environment. And as well, it has been an outbreak of multi-resistant Campylobacter originated in puppies that were bought in pet stores that spread across 17 states. There were 23 hospitalizations and a total of 113 human cases originated from these puppies with a multi-resistant Campylobacter. So it's a responsibility as veterinarians, and it's really in our hands to do everything that we can to use antibiotics properly, because this is a problem, and if we don't do that, antimicrobial resistance is going to spread like wildfire, and we're going to lose a very important tool to treat our patients. So getting to the end, this is one of my family's favorite hikes in Daniel Boone National Forest in Kentucky, and that is called the Court Rock. As we've seen, this is a complex topic. My vision about tackling this complex topic is that veterinarians need to take a leadership role. They need to educate, because implementing proper infection prevention will provide better patient care, decrease cost, better use of antibiotics, and ultimately save lives. This is a journey, and we should all be in it, and it's going to be a long journey, but we need to start now to change the way we practice medicine to care for our animals. The whole animal care team should be involved in these. They should all be invested in infection prevention, and we should all be part of the community and educate the owners of pets about the importance of bringing animals to their veterinarian, the importance of vaccination, the importance of proper antimicrobial use. And also reach across the aisle. Remember that this is a multidisciplinary science. We cannot do it ourselves. We need to learn from other disciplines, and really just don't be afraid to ask. Because ultimately, what we want to do is provide the best care for our patients that we can. And I would argue, as have others, that proper patient care cannot be delivered without having infection prevention protocols in place, which will include vaccination and proper antimicrobial stewardship. Great. So this is all that I had to say. And if you're wondering where this picture is from, this is from the changing of the guards in Buckingham Palace in England. A beautiful spectacle to see.